All right, so now let's have a look at the temporal and infratemporal regions. These are actually called the temporal and infratemporal fossae, the plural of fossa. And these are interesting regions because there are some interesting muscles and nerves and arteries that are especially in the infratemporal fossa. Okay, so in the temporal region, you can see there are these two lines. One of them is called the superior temporal line, which serves as an attachment site for the temporalis fascia, for the muscle of the same name, and the inferior temporal line for the temporalis muscle as well. Okay, we can also see that there are several bones that contribute to the formation of the temporal region. Specifically, that will be the four bones that contribute to the formation of the pterion, which is this region right here. See, it looks a little bit like an H, and there are four bones that contribute to it, namely your frontal bone, your parietal bone, your temporal bone, and your sphenoid bone. The inferior boundary of the temporal fossa is going to be the infratemporal crest, which is below here. The anterior boundary is going to be parts of the frontal bone and the zygomatic arch with the zygomatic bone. The lateral boundary is actually the zygomatic arch, which you can see here. And the zygomatic arch is made up of both a part of the zygomatic bone, but also part of this bone here, your temporal bone. The roof will have been formed by fascia, specifically by temporalis fascia. Now we can see some of it. Now we don't. And we've already discussed the floor. The infratemporal fossa is actually a space that is going to be below the temporal fossa and deep to the mandible, specifically actually deep to the ramus of the mandible, which is this part here. It is posterior to the maxilla. If I turn this and rotate the head a little bit, we can dive into here, and now we can see that the infratemporal fossa is going to be posterior to the maxilla and inferior to the temporal fossa. The boundaries of the infratemporal fossa are going to be laterally the ramus of your mandible. So why don't we just go ahead and hide the mandible now? There we go. I'm going to rotate back into our regular view. The posterior boundary is going to be your styloid process, your mastoid process, and the tympanic plate. Medially, this bone here, which is the lateral pterygoid plate, is going to be your boundary, and superiorly, the infratemporal crest of the greater wing of the sphenoid bone. There are several communications of the infratemporal fossa with the surrounding areas. So now I've turned off all the colors, and we can see what happens if I also cut out the zygomatic arch. So we can see a couple of features that will enable the infratemporal fossa to communicate with the surroundings. We have the pterygomaxillary fissure, which is approximately here. There's a communication between the infratemporal fossa, laterally, and the pterygopalatine fossa, which is going to be medial or deep to this here. Okay. There's also an opening here called the sphenopalatine foramen. That's an opening in the medial wall of the pterygopalatine fossa that will then enter the nasal cavity medially. So we can actually see from here there's a communication between the nasal cavity and the infratemporal fossa. We have the inferior orbital fissure. If I change the orientation a little bit, here is the inferior orbital fissure that is between the greater wing of your sphenoid and the maxilla. The infratemporal surface of your maxilla is also an important boundary here, and the lateral plate of the pterygoid process, which is this one here, part of the sphenoid bone, is a fairly apparent landmark. There's another feature which is not going to be visible very clearly here, but it is important for us to understand that it exists in lab. There's an opening called the petrotympanic fissure that actually goes to the tympanic cavity, but there's a little nerve that will be exiting out of that fissure called the chorda tympani. We will learn some more about that later on, which is very important because it joins another nerve, namely the lingual nerve, and conveys, for instance, special sensory fibers such as taste, or also parasympathetics that are headed towards the submandibular ganglion. So now let's go ahead and have a look at the muscles of mastication, right? We have four pairs of muscles of mastication, your masseter, and then your medial and lateral pterygoids, which are a little bit deeper, so they're hard to illustrate like this. We'd have to dive really deep in here to get below or deep to the ramus of the mandible. Let me go ahead and hide these muscles of facial expression. And let's start off with the muscle called the masseter. This here is the masseter muscle, and the masseter is a strong muscle of mastication. It has both superficial fibers, which are highlighted now, and it has deep fibers. The superficial fibers will actually arise from the zygomatic process of the maxilla and also the lower border of the zygomatic arch, and deep fibers will arise from the lower border and the medial surface of the zygomatic arch. The insertion is going to be into the lateral surfaces of the coronoid process, which is this bony process on the mandible, and also along the ramus and the angle of the mandible. Since the deep fibers that you can see right here run a little bit more vertically and the superficial fibers will run a little bit more obliquely, the masseter doesn't only elevate, but it'll also be able to protract the mandible. Let's have a look at this in movement. Here you see the superficial fibers in action. When the fibers of the masseter contract, it elevates the mandible, but also protracts a little bit. Those are the superficial fibers, and here are the deep fibers. Okay, next up is the temporalis muscle. As you can see it up here, let me move everything down. This large muscle is the temporalis, and the temporalis will originate along the floor of the temporal fossa, so it has a pretty broad origination or proximal attachment, and distally it'll attach on the carnoid process, as you can see here, it's indicated in blue, and also along the anterior border and the ramus of the mandible. Now I've cut out the parts of the zygomatic arch and the zygomatic process of the maxilla that were in the way. Now you can see the distal attachment site of the temporalis a little better. If I click on this button, we can actually see it from the lateral view, we can see it from posteriorly, and we can see it from anteriorly as well. And let's have a look at it if we can see the motion as well, see if we can activate the retraction of the temporalis. See, with the fibers that are actually more horizontal, when they contract, they're eliciting their pull on the coronoid process. That means it's going to move posteriorly, so that will actually lead to retraction. If I try and highlight the fibers that are going to elevate, we would have a look at the more vertical fibers, and the way they act is then by pulling up on the coronoid process, which leads to elevation of the mandible. If I fade the masseter, it becomes a little bit more apparent. Okay, the next two muscles we're going to look at are going to be the pterygoid muscles. We have medial and lateral pterygoids. Here's the lateral pterygoid, and here is the medial pterygoid. The medial pterygoid muscle actually has two heads. It has deep and superficial heads that will be arising from the medial surface of the lateral pterygoid plate, in addition to the maxillary tuberosity. The distal attachment will be the medial surface of the angle and the ramus of the mandible. The main action of this muscle is going to be protraction and elevation of the mandible. The lateral pterygoid muscle up here has two heads, has a superior and an inferior head. The superior head will attach proximally at the infratemporal surface of the greater wing of the sphenoid bone. The inferior head attaches on the lateral surface of the lateral pterygoid plate. The insertion is going to be on the condyle of the mandible, the capsule, and the articular disc of the TMJ. So let me go ahead and add in a couple of bony and cartilaginous features so we can properly see this. And remember, if you are using the software, you can always use the tool that is called the cutting tool. You highlight the scissors and you just click on the part that you want to get rid of. And like that, I was able to cut out the coronoid process. Let me go ahead and make one more cut. Now you can see the proximal distal attachment sites, some people call this origins and insertions as well, of the lateral pterygoid. Here's the superior head, here's the inferior head. You can see that the distal attachment is going to be, or actually the insertion is going to be, both on the condyle of the mandible, the capsule, and the articular disc of the TMJ. Remember, the TMJ allows movement in more than just in one plane. We can open and shut our mouth, but of course we can also protract and retract it, and we can also do grinding motions. And that is exactly that one thing that the pterygoid muscles, if they are working in concert, are very good for. When they alternately move, so left and right, you can imagine they will actually pull the mandible left and right and will lead to grinding motions. Let me see if we can activate the motion button here for us. This is now the elevation of the mandible. Now we see the medial pterygoid and its lateral movement of the mandible. And if you look at the molars and the surfaces of the molars, you can imagine that these are perfect mechanical devices to grind up food particles. And here we're going to show protraction done by the medial pterygoid. And let's have a look at the motion of the lateral pterygoid. First it'll be the protraction of the mandible. Let's move around here. And see, because the lateral pterygoid is mainly horizontal, when these fibers contract, it's going to be pulling the head of the mandible, this one, out of the mandibular fossa and anteriorly, which results in a net movement of protraction. Lateral movement. Also here, the lateral pterygoid plays a role in the lateral movement, just like the medial pterygoid does as well.